Well, good afternoon, everybody, and thank you very much for joining me for this session. As Jay said, yes, my name is Jack Mazzina. I guess my official title is Commercial Director for the workforce business within Liaison Group. You may have heard of Liaison before. We've been working with the NHS, in particular supporting NHS Scotland for the last 34 years. We started off in VAT consultancy, but we've really broadened our horizons. And we now have three distinct businesses, one of which is workforce. And I'm going to talk about an issue today which I don't profess to be an expert in by any means, but it's an issue I'm passionate about, I'm learning more about, and just wanted to share some experience that we've had as a business today in looking at, I guess a relatively new area in terms of how can we measure well-being in the NHS, and just share an example of an organisation that's tried this and some interesting insights we've learned from them. I'll try and get through the slides in time so you've got a chance to answer any questions at the end. Anyway, first of all, I'm just going to start off with a definition for well-being. We looked out there at well, how do we define that? We found some pretty good resources available, and probably the best definition we came across was well-being is how we are doing as individuals, communities, and as a nation, and how sustainable this is for the future, which I thought was a good example of that. And in particular, interested in the part about sustainability, because obviously well-being, we can feel fantastic today, but as we all know, things can change, and our state of well-being can change by the hour, by the day. So it's how can we give ourselves the best opportunity to sustain a good state of well-being for over a long period of time. We looked into some of the factors that affect our well-being, and none of these will be a surprise to any of you who've joined us today. But fundamentally, how we feel overall about our lives, it can be affected by our physical, mental health, and the relationships we form with friends, with family, with colleagues, in particular our work and finances, which is particularly prevalent at the minute with the cost of living crisis we've got, with energy bills going up, both at the fuel court and at home. And then beyond that, it's the environment we have around us, a sense of belonging, the things we do, and the trust we have in others. And that seems to be a lot of factors on one page. So we looked at how that could be condensed, and we found a useful resource where well-being was condensed into 4 pillars of well-being: physical, mental, social, and financial. And each one of these pillars is really important to achieving a good state of well-being. And there's no particular one that's more important than another, because they all rely on each other. If one of these pillars fails, then they all fall down. And there's no easy. Oops, sorry, I'll just go back to that. And there's no quick fix to achieving a good sense of well-being. It's not something that happens overnight. It's not a quick action. Achieving a good state of well-being takes work. And you have to find time to exercise, to eat well, to make effort to socialise with friends and family. And just drawing on that, we've all experienced recently in the pandemic that we weren't able to do all those things. We had rules in place that prevent us from doing that. So it's no surprise that everybody's well-being was affected. And it's important to remember that for individuals, managing their well-being is not something that they have to do just on their own. There's support available, from professionals, from friends, from family, and in particular employers. And I guess in the NHS, that's where we have an important role to support the well-being of our staff. And obviously, the research shows that people with high levels of wellness and well-being are likely, they're more likely to be happier, healthier across the board. They'll have a good network of social support. And these individuals are more likely to be productive, they're more likely to be motivated, and they're going to achieve better results. And clearly in the NHS, that translates to, we've got a workforce with a high level of well-being. That translates directly to, a higher quality of care, better patient outcomes. And, affected by that, it affects our pay bill. It's what we spend our money on, where we've got high turnover of staff, or we're struggling to attract staff because we can't provide a good state of well-being in the workforce, and that costs us money, costs the taxpayer money. So it helps us overall become more efficient. Now, just moving on, can you measure well-being? Well, I think this is a really interesting point of discussion. Can well-being, is it an experience that can be quantified? Personally, I think it's quite subjective. I could say on a scale of 1 to 10, how happy are you today? And that would give us some indication. But I think well-being is a lot more complex than that. When it comes to individuals, we have people with different personalities and entirely different set of circumstances, which makes it really difficult to measure. So we're going to look at how we can do that, because in particular in an NHS context, as an employer, it's difficult to sit down and agree, to build a KPI or a particular metric to measure a particular area. So we're going to explore where could we start with that, different approaches that have been taken, and I'm be interested to hear if anyone who's attending this afternoon has tried anything this way that we can perhaps compare it to. So measuring wellbeing, where could we start? Well, we went out there because I think this is a new area for the NHS. It's not something that has traditionally been measured. I know it's been centrally driven at the minute to start capturing this. So we went out there and we looked at some different resources, and again we came across some interesting stuff from NHS employers, which I thought I'd talk about. And clearly, if you're going to measure wellbeing as an organisation, it's really important to have define and have some really clear objectives of why you're going to do that. Not just because we're being asked to, but actually, if we're going to do this, let's really focus on making it a success. So, starting with what does success look like if we're going to measure wellbeing, and can we define it? Is it achievable? And how are we going to, if we're going to intervene with a program, what impact is that going to have, and how are we going to measure that? What outcome are we looking to achieve? Is it improved mental health? Is it reduced absenteeism, fewer occupational health referrals? And you could measure wellbeing in many different ways. One thing we found that's really important is being able to give staff the opportunity to feed back into any process or program you're running. They can feed back into how it's run. First of all, they're going to tell you how best to run it to get high levels of engagement, and high levels of engagement equals you're going to get much more impactful data and give you a much greater chance of success with a program. Interesting one is, have you considering both quantitative and qualitative data? Well-being isn't necessarily a stats we can derive from our staff. I think it's something we have to combine both, and the qualitative data is going to help give some context to the stats that we get. And finally, it's great being told that we have to do these things which we want to measure well-being, but actually, do we have the capacity and resource within our teams to do this effectively? And is this going to mean that we neglect another area of our organisation? So these are important factors to consider. One thing we could do is we could look at the data points that already exist. So we know there are a wealth of systems and data sources out there already that we could draw on, and they could give us some indication of the state of well-being of our workforce. So it could be things like the Health and Social Care Staff Experience Report. We have patient satisfaction rates, sickness absence, staff performance evaluations, where we have employee assistance programs in place at the health boards. How many of our staff are joining these? What kind of issues are they flagging? Can we get data out of those? Even agency spend can be an indicator of, if you've got high turnover, staff leaving, and you're struggling to recruit, it could be an indicator of well-being within an organisation. One thing that we've looked at is a particular challenge out there, and reports, a report conducted last year has found, and this will be no surprise to anybody, that the importance of real-time data. So all the data points we've highlighted previously, a lot of these give a snapshot at a point in time, but they can quickly become out of date, and they aren't necessarily giving us the actionable insights that we need now to intervene and deliver programs to help change well-being within our workforce. But this challenge is going to remain. How can this be achieved at scale without overly impacting resources? And that kind of cues me up to introduce a bit of a case study of where we feel this has been done successfully in the NHS with using a digital tool. The digital tool itself is called My People Planning, and this was run at an NHS organisation where they were driven by, they knew that wellbeing conversations as an initiative was being driven centrally by the NHS. And for them, you know, paper-based conversational initiatives, it's really hard to drive adoption within your staff to collect this information and gather it in a meaningful format that can give you evidence to act on and improve the state of wellbeing within your workforce. So they came across this tool, My People Planning, and by using the technology, it gave them the opportunity to gather data by engaging their managers, and not just gather that in a consistent format, but also anonymously. With well-being, a lot of the issues discussed can be really sensitive, and people might be more likely to open up and share things and provide information where they can't be identified to help their employer help them if they can do it anonymously. And the technology gave them the opportunity to do that in an easy manner. Additionally, with technology, technology isn't here to replace people, and this is about humans and machines working in harmony, if such thing can exist. But actually let the technology do the heavy lifting. Can that automate manual tasks and process? So as managers, we can focus on the important things, where it be acting on the data and deploying programs to improve our outcomes. Capturing information in a consistent manner using technology gave this organisation the opportunity to track and monitor the positive outcomes, so they could start to measure where they had programs, where they were acting on programs, what impact they were having. And obviously, one of the most important things is it's great getting data, but it's about turning data into actionable information. So they're not spending time crunching data and trying to work out what does the data mean. It's actually saying, oh, this is telling us something, we can now act on that. So just a quick exec summary of this is an example of some of the data they got. And coming back to the real-time aspect of this, they spent 3 weeks, and they used this digital tool to engage their managers, and they gave them 3 weeks to come back and populate in almost like a survey fashion. But I'll move on from that and explain later why we call this a digital conversation, because it's much more than surveying staff. This is a two-way digital conversation where the managers can get something in return for every piece of information they submit. But they gave their managers 3 weeks to submit information on their teams. They asked them a series of questions around well-being concerns, and after the 3 week period closed, within 1 week they had sight of this data, which gave them some real insights into where they could prioritise their work moving forward. It was a small population, so they tried it in one area of their organisation. So there was a possible 92 managers, and they saw nearly 70% of managers participate. And 52% of those, it was a really easy process. They completed it in less than 15 minutes. And the upshot of that is they identified at least 2 wellbeing concerns per manager they spoke to. So there's a number of wellbeing concerns, and they were able to start categorising them, as you can see on the right. Interestingly, this was conducted in April. We were expecting to see financial wellbeing as the top category. It actually turned out it was mental health. And you can see there that mental health was by far the biggest problem within this organisation, or within this area. They found out that their managers were actually having wellbeing conversations, which surprised them. Over 186 were recorded. Some managers were fantastic at doing this within their teams. Some managers hadn't had any. But the beauty of this data is it told them who was having them and who needed support with, or encouragement or prompting to start having wellbeing conversations with their staff. They identified that there's over 70 people within this area of the organisation that want to be a wellbeing champion. They want to support and champion improving the state of wellbeing for the staff, which is a fantastic thing. The biggest thing by far for them was they found that requesting for flexible working was a big ask to help improve staff wellbeing, and it was something that managers felt like they weren't really equipped to deal with that request, and that they didn't know how to action this. So straight away they got a great insight there, and in particular they identified 7 people that were flight risk. They were thinking they might leave the organisation, and instantly their finance team were on this, and they said, well, that's if they leave, that's going to cost us nearly 130,000 in terms of the gap it leaves by filling that gap through expensive banking agency, the cost to recruit somebody and train them up. So this is real money that if they can intervene now on this data, they can avoid that cost. Moving back to the automations that technology can bring. So as I said, this is about having a two-way conversation, using technology to have a two-way conversation. So where a manager flags a well-being concern or a flexible working request, the technology is then programmed to automate and provide that manager with, yesterday you told us that you have this person that requested flexible working. Here's our flexible working policy. This is the process we need to follow to acknowledge this request and review it. So straight away for managers, it's helping them help their own teams and do it in a fast manner, and that it's something where a member of the workforce and OD team isn't having to intervene at this stage. As I said, in summary, we've listed there some of the key things they kind of concluded from this exercise, but particularly one of them was, as I said before, flexible working is a hot topic for this organisation, particularly in this area, and managers weren't equipped to deal with that. So straight away, they'll be able to act on that and improve. As an organisation, they're really pleased. They've got more data and insights than they were expecting just on a real small population. They're now planning to go back to the managers that participated and get their feedback on what it was like to use the tool. How could they improve the process moving forward? And then their future plans are to roll this out across a much wider manager population of over 1,800 managers, and something where they can start to repeat this exercise every 12 weeks and then capture what has changed. What has changed since last time you told us about this wellbeing concern. Does it still exist? And what actions have you taken? So they can really start to measure and act on this data. I'm just conscious of time. I'm getting towards the end now, but just to flag that my people planning as a tool is part of a number of different workforce programs that Liaison are involved with in the NHS to help manage wellbeing and overall workforce management. It complements other solutions. So we have, I think it's been mentioned earlier today, around how can we, there's in the NHS we have lots of systems out there. How can we get a single picture on one screen? Well, we can help with that with a people analytics platform where we can intelligently combine data from all your different workforce systems using one system that can sit on top and give you a powerful single source of the truth to help get actual analytics. So can we link in wellbeing data to to levers data? Can we link it into appraisal data? And we can start to form a real much more impactful picture of what's really going on with the workforce in our organisation. I'm just going to spend a little bit of time talking about my people planning as a tool, because it's a really diverse tool. Within the case study I've shared today, there was a real focus on well-being, but actually my people planning as a digital solution, it can look at all aspects of workforce risks associated with attrition. So it really is, if you think about, for every 100 line managers within your health board, if you had a 20-minute conversation with each line manager to understand what's going on in their world, the state of their workforce, and it would take you 125 hours to complete that manually. And you need an army of HR people, which we know HR are overstretched as it is in the NHS. So that's where my people planning comes in place. It helps increase the capacity of your HR team and helps you rapidly obtain key people data. And the different areas in which my people planning can look at, it can obviously look at wellbeing issues, but elsewhere in the NHS, we're seeing it's been used to capture future vacancies. So we've got an organisation in North West England who use this tool to look at future recruitment requirements that are coming up in the next 6, 12, 18 months. And I think just by speaking to over 400 managers, they identified 114 planned vacancies that weren't logged on any system within their organisation. And I think on average, they got an extra 80 days lead time to recruit those vacancies. So first of all, decide, do we really need this? Can we upskill another area? We're actually given extra time to recruit those vacancies. They also captured key learning and development requirements within their staff. It actually showed them as an organisation that they were investing their learning and development budget totally in the wrong areas. So they were spending it on band 7 and 8 nurse staff who actually it was the band 5 and 6 who were looking for the development, who wanted to progress their career and were at risk of leaving if they didn't get that learning development. So some good insights there and examples of how technology can not just help you with well-being, but in all aspects of workforce management. I'm conscious of time, so I'm not going to go through the other areas, but we'll share the slides afterwards. But obviously we've also looked into a wealth of other further resources that exist out there. So we thought if you're looking for not just Liaison but other areas, we can share these afterwards. But I'm going to wrap it up there. I've got just over 3-4 minutes left. So have we got any questions?
Yeah, so we've got one question in the chat came through from Judith, who was asking, is the initiative confined to Scotland, or is there something similar equivalent to England, of which I think you've answered that question anyway?
That's right. Yeah, so it's not confined to a particular area. Down in England, we're talking deploying this not just locally within organisations, but also across integrated care systems. So, this tool could be deployed in, a ward, a department, health board wide or nationally. It's and the beauty of it is, unlike traditional survey software, it's not going to give you an unrepresented picture. Every piece of information you receive through this tool can be helpful because it tells you something that you didn't already know.
Thank you, Jack. We've got a feedback from Lisa. They've used iMatter in health boards and found this a really useful tool in the directorate she leads. She's keen to learn more to see how this could support a large GP group with 200 approximate in the workforce. And then June has a question. Have you heard of the term locus of control?
Well, okay. So, well, first of all, in response to Lisa, absolutely. This tool, it can be deployed in any setting. We came across it because it was deployed in the commercial world historically, and we thought this has got to work in the NHS. So far, we haven't seen anything quite the same as it. So it'll be interesting to speak to Lisa and find out what iMatter has done and obviously explain a bit more. In response to June, no, I haven't heard of locus of control. I'd be interested to hear for you to elaborate on that and explain what it means.
Are you happy to unmute June to contribute to that answer? She doesn't know how to switch it on. If we just stop sharing your screen, we can see everybody then. That's
sorry, yeah, I'll do that.
Session. There we go. Let's have a look.
Oh, hi. Oh, yeah, I'm here. Oh, no, Jack, it was just, I was involved in a project in Belfast about 8 years ago, and there was 8 of us, and there was a psychologist as part of the group. And what we were trying to do was measure well-being across the population of Belfast, because of the disparity in death rates. In some areas, people were dying in their 50s, in other areas were living to their 80s. So, but this is what we proposed to the City Council then, to use this kind of methodology to measure well-being. So it was the site, I don't have the details of it, it was just to see if you'd come across it, but it was a psychologist who suggested using this locus of control. It's a kind of like measure you use specifically for well-being. And
I'll look into that. Thanks for sharing that.
It was just something, just wondered if you'd heard of it. Yeah.
Well, thank you for that, June. I think there's another question in the chat. I'll just remove it from the pin. There we go. So Yvonne says, great presentation. I think well-being is often hard to define, as what is good well-being can be different for each individual, but she liked how this was set out. Thank you for that feedback, Yvonne.
Well, thanks, Yvonne. And I totally agree. Some people have higher standards than others. I guess is one way of putting it when it comes to well-being. Or some people are hard to please, and you know what I mean. But yeah, I totally agree. I think the key to this is sometimes simplifying it, and a starting point is identifying, where do we have well-being issues, and can we categorize them and find out where they are, because it at least gives you a starting point as to where to focus your efforts.
Absolutely. And
which I think anecdotally the NHS they know some of the issues, but it's hard to target this support where it's needed, where it's tools like this can do that.